Neck. 1. Which of the following features favor Rath's cleft cyst rather than craniopharyngioma? Absence of calcification. B. Cystic element on Mr. C. Involvement of suprasellar and sellar regions. D. Enhancement of the Wall. E. High signal intensity on T1. Module 6. Central nervous system and head and neck. 1. Rathke's cleft cysts do not calcify. They affect women to men in a 2:1 ratio and adults from 40 to 60 years of age. They cause variable Mr. appearances depending on protein content of cyst. They can rarely show enhancement. Ref. T1. 2. A 38-year-old male with human immunodeficiency virus, HIV, stopped taking his retroviral 6 months ago and now presents with confusion. CT brain shows non-enhancing hypotensities, with apparent dilated perivascular spaces, although these were not present on a CT brain from 2 years ago. What is the most likely cause? A Cryptococcus B. Progressive multifocal leukoencephalopathy. C. Tuberculosis. D. CMV. Encephalitis. E. Toxoplasmosis. 188. Module 6. Central nervous system and head and neck. 188. Module 6. Central nervous system and head and neck. 1. Rathke's cleft cysts do not calcify. They affect women to men in a 2:1 ratio and adults from 40 to 60 years of age. They cause variable Mr. appearances depending on protein content of cyst. They can rarely show enhancement. Ref. RAL VJAL imaging characteristics of common suprasellar lesions with emphasis on MRI findings. Clinical radiology 2000 toxoplasmosis. 3. A 30-year-old male with recurrent transient ischemic attacks, tears, and a history of migraine with aura undergoes CT brain. Subcortical infarcts are identified, raising suspicion of cerebral autosomal dominant arteriopathy with subcortical infarcts, CADASIL. Which is the most characteristically involved location for subcortical infarcts? A. Anterior temporal pole. B. Frontal lobe. C. Centrum semioval. D. Deep gray matter structure. E. Pawns. 2008, 63, 8 939 to 947. 2. A more commonly Cryptococcus meningitis, but Cryptococcus or gelatinous pseudocysts reside in dilated perivascular spaces. Ref. RAL VJAL imaging characteristics of common suprasellar lesions with emphasis on MRI findings. Clinical radiology 2008, 63, 8 939 to 947. 3. A young patient with migraines, auras, tears or subcortical strokes should raise suspicion of CADASIL. Subcortical infarcts are characteristically in the anterior temporal pole and external capsule but may involve C, D and D. Ref. Downer JJAL symmetry in computed tomography of the brain, the pitfalls. Clinical radiology 2009, 64, 3 298 to 306. 1. Question bank. For a 40-year-old with headache, confusion, seizures and visual disturbance has a CT showing low attenuation involving the cortex and subcortical white matter in both occipital lobes. Diffusion weighted Mr. shows no restriction. Which is the most likely diagnosis? A posterior reversible encephalopathy syndrome. B. Bilateral occipital infarction. C. CADASIL. D. Sinus venous thrombosis. E. Hypoxic brain injury. Answers. 4 of these are typical imaging findings, but the abnormalities are not always reversible or posterior. Ref. Downer JJAL symmetry in computed tomography of the brain, the pitfalls. Clinical radiology 2009, 64. D. Sinus venous thrombosis. E. Hypoxic brain injury. 5. Which is the best answer describing neuroimaging features of preeclampsia? A most frequent abnormality on Mr. is high signal change on T2/fluid attenuated inversion recovery, FLAIR. B. Lesions are in subcortical white matter only. C. Majority of lesions progress to infarction. D. Lesions are unilateral. E. Cerebral vasospasm is common in mild to moderate preeclampsia. 6. MRI of a mass in the parotid tail shows a well-circumscribed heterogeneous lesion with mixed cystic and enhanced 3 298 to 306. 5 lesions are in deep. Deep and subcortical white matter, pons and basilar territories. They may be unilateral or bilateral and the majority are reversible, although some can progress to infarction. Vasospasm is uncommon in mild to moderate preeclampsia. 6. A Warthin's tumor. Enhancing solid components. Earlier US showed vessels in a hilar distribution with branches in the septa of the structure. There is no lymphadenopathy. What is the likely cause? A Warthin's tumor, B. Ductal cyst, C. Lymphepithelial cyst, D. Pseudoaneurysm from a branch of the external carotid artery, EAVM. Tumors are benign salivary gland tumors, accounting for 6 to 10% of all parotid tumors. Warthin's tumors are bilateral in 15% of cases. Ref. Dynine RTL imaging of acute neurological conditions in pregnancy and the puerperium. Clinical Radiology 2005, 60, 11-1156 to 1170. 7. BER causes of cerebellar atrophy. Module 6, Central Nervous System and Head and Neck. 7. Which of the following is a cause of cerebellar atrophy with cerebral atrophy? A senile brain atrophy, B. Friedreich's ataxia, C. Ataxic telangiectasia, D. Phenytoin toxicity, E. Paraneoplastic atrophy. Atrophy without cerebral atrophy. Ref. Dana W. 2007. Module 6, Central Nervous System. Atrophy. A CT brain of a 25-year-old male with a head injury but no focal neurology shows no acute abnormality. A thin cerebrospinal fluid, CSF, density is noted between the frontal horns of the lateral ventricles in the midline. Which is the diagnosis? A cavum septi pellucidi, B. Cavum virgae, C. Cavum veli interpositi, D. colloid cyst, E. arachnoid cyst. System and head and neck. ATA occurs in 80% of term infants and 15% of adults. Rarely may dilate and cause obstructive hydrocephalus. Hydrocephalus. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. p. 236. 9 Aglioma consist. Cyst. 9 Which brain tumor has the greatest incidence across all age groups? A glioma, B meningioma, C metastases, D pituitary adenoma, E hemangioma. Consist of astrocytoma, oligodendroglioma, paraganglioma, ganglioglioma and medulloblastoma. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams. Hemangioblastoma. 10 Which of the following is an extra-axial posterior fossa tumor in adults? A choroid plexus papilloma, B metastasis, C hemangioblastoma, D lymphoma, E glioma. 100. And Wilkins. p. 238. 10 other extra-axial posterior fossa masses include acoustic neuroma, meningioma, chordoma and epidermoid. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. p. 239. Question bank. 11. Which is the most prevalent intraventricular tumor? A. Astrocytoma, B. Meningioma, C. Choroid plexus papilloma, D. Dermoid, D. Subpendymoma. 12. Which is the cause of lower 190. Module 6, Central Nervous System and Head and Neck. 8. Occurs in 80% of term infants and 15% of adults. Rarely may dilate and cause obstructive hydrocephalus. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. p. 236. 9. A glioma consist of astrocytoma, oligodendroglioma, paraganglioma, ganglioglioma and medulloblastoma. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. p. 238. 10 other extra-axial posterior fossa masses include acoustic neuroma, meningioma, chordoma and epidermoid. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. p. 239. 11 ependymomas followed by astrocytoma are the most common. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. p. 200. Attenuation in the basal ganglia. A Wilson's disease B. Hypoparathyroidism C. Pseudohypoparathyroidism D. Hypothyroidism E. Radiation therapy. Answers. 12 other causes increase carbon monoxide poisoning, barbiturate intoxication, hypoxia, hypoglycemia and lacunar infarcts. Therapy. 13 On review of an MRI of a complex case marked hypointensity of the globus pallidus is noted on T2W1, surrounding a higher intensity center, eye of the tiger sign. Which is the most likely cause? A Dandy-Walker malformation B. Multiple sclerosis C. Hypoparathyroidism D. Wilson's disease E. Hypoglycemia. Philadelphia, Lippincott Williams and Wilkins. P. 244. 13 Due to excess iron accumulation, a central gliosis is associated with Holt-Avoden-Spatz disease, dementia, retinitis pigmentosa, X-linked disorders with mental retardation, atrophy and Parkinsonian disorders. Ref. Hypoglycemia. 14. Which of the following features describes an intraaxial mass? A cortex displaced towards bone B mass contiguous with dura C buckling of gray and white matter D widened subarachnoid cystine dural feeding arteries. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. P. 241. 14 A BER extra axial features. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. P. 204. Module 6, Central Nervous System and Head and Neck. 15 Which of the following favors an arachnoid rather than an epidermoid cyst? A hyperdense to CSF on CT. B. Smooth margin C. Encased vessels. D. Deviates from CSF on proton density. E. Restricted diffusion. (191) Answers. 12 Other causes increase carbon. 191 Answers. 12 Other causes increase carbon monoxide poisoning, barbiturate intoxication, hypoxia, hyperglycemia and lacunar infarcts. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. P. 244. 13 Due to excess iron accumulation, a central gliosis is associated with Holt-Avoden-Spatz disease, dementia, retinitis pigmentosa, X-linked disorders with mental retardation, atrophy and Parkinsonian disorders. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. P. 241. 14 BER extra axial features. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. P. 246. 15 BA and C are features of epidermoid cyst. A and C demonstrate CSF-like density and have smooth margins. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. P. 276. E. Restricted diffusion. 16 A 40-year-old male has a CT brain to investigate seizures. Which of the following best describes a cavernoma? A popcorn appearance with high psi center on T1 plus T2b. Most commonly occurs in the cerebellum. C. Usually considerable mass effect. D. Hypodense region on CT. Rarely calcify. Module 6, Central Nervous System and Head and Neck. 16. Cavanomas are most commonly located in subcortical regions and are hypodense areas which can calcify. They are associated with minimal mass effect / edema. Cavanomas can undergo hemorrhagic change and are associated with seizures. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lipin. 176. Module 6, Central Nervous System and Head and Neck. 15. Which of the following favors an arachnoid rather than an epidermoid cyst? A hypodense to CSF on CTB smooth margin C encased vessels D deviates from CSF on proton density E restricted diffusion. 16. A 40-year-old male has a CT brain to investigate seizures. Which of the following best describes a cavanoma? A popcorn appearance with high psi center on T1 plus T2B. Most commonly occurs in the cerebellum C. Usually considerable mass effect D. Hypodense region on CTE rarely calcify. 17. Which of the following associations favor Chiari rather than Chiari 2 malformation? A Klippel-Fehl anomaly B. Myelomyosele C. Dysgenesis corpus callosum D. Absence of septum pellucid E. Excessive cortical gyration. Lippincott, Williams and Wilkins. p. 273. 273. 17. A syringohydromelia, hydrocephalus, malformation of small bones and spine are also associations of type I Chiari malformation. 18. B. Pro. Gyration. 18. Which of the following best describes imaging changes in a colloid cyst? A typically hypodense on non-contrast CTB appears high psi on T1C appears low psi on T2D commonly widens septum pellucid E. Most commonly causes symmetrical enlargement of lateral ventricles. Protein content / paramagnetic effect of magnesium Mg2 plus / calcium Ca2 plus / iron Fe in a cyst cause increased T1 and T2 psi. Colloid cysts appear ISO / hypodense on NCCT. They can occasionally widen septum pellucidum and cause asymmetrical enlargement of the lateral ventricles. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott, Williams and Wilkins. p. 277 to 278. 193. Answers. 19 are located in CPA in 40%, accounting for 5%. Question bank. 19. Which is the most common location for epidermoid in the central nervous system, CNS? A cerebellopontine angle, CPA, B. Suprasellar region C. Perimesencephalic cystons D. Ventricles E. Skull vault. 20. 5% of CPA tumors. Ref. Dana W. 2007, Radiology. 100. 192. Answers. 19 are located in CPA in 40%, accounting for 5% of CPA tumors. Tumors. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott, Williams and Wilkins. Which of the following is not typical of Creutzfeldt-Jakob disease, CJD? A progressive dementia B ataxia C hyperintensity on T2 in head of caudate and putamen D bilateral involvement E gadolinium enhancement of lesion. Wilkins. P 286. 20 E no gadolinium enhancement and no white matter involvement. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. P 300. 303. Lesion. 21. Which of the following favors dural meningeal carcinomatosis rather than leptomeningeal carcinomatosis? A short discontinuous thin sections of enhancement. B positive cytology. C thin area of subarachnoid enhancement following convulsions of jury. D discrete leptomeningeal nodules. E invasion of underlying brain with mass effect and edema. (303). 21. A dural meningeal carcinomatosis is rarely associated with positive cytology and involves localized or diffuse curvilinear enhancement underneath in a table in expected position of dura. Ref. Dana W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. p. 306. Edema. 20. Which is the cause of a cystic rather than a hemorrhagic cause of brain metastases? Metastases. A. Adenocarcinoma of the lung. B. Malignant melanoma. C. Choriocarcinoma. D. Renal cell carcinoma. E. Thyroid carcinoma. Module 6, Central Nervous System and Head and Neck. 22. A squamous cell lung cancer and adenocarcinoma of the lung cause cystic metastasis to the brain. Answers B are causes of hemorrhagic metastases. Ref. Darner, W. 2007, Radiology Review Manual. 6th edition. Philadelphia, Lippincott Williams and Wilkins. P. 309 to 310. Module 6, Central Nervous System and Head and Neck. 23. Which is the most common location of oligodendroglioma? A. Frontal lobe. B. Temporal lobe. C. Parietal lobe. D. Occipital lobe. E. Cerebellum. 309 to 310. 23. A most commonly involve cortical and subcortical white matter, occasionally through corpus callosum as butterfly glioma. Ref. Darner, W. 2007, Radiology Review Manual. 6th edition. Philadelphia. Philadelphia, Lippincott Williams and Wilkins. P. 320. Cerebellum. 24. Which of the following best describes the typical appearance of intracranial hemorrhage in the late subacute phase, 8 to 30 days? A. B represents early subacute hemorrhage, C represents acute, 12 to 72 hours, D days. A. Increased T1, increased T2. B. Increased T1, decreased T2. C. Isointence T1, decreased T2. D. Isointence D1, increased T2. E. Decreased T1, decreased T2. represents hyperacute, less than 12 hours, and E represents chronic hemorrhage, 1 month. T2. 25. A combination of subendymal nodules, giant cell astrocytoma, white matter lesion and retinal phacomatoses suggests a tuberous sclerosis BNFICNF2D Sturge-Weber syndrome E. von Hippel-Lindau, Ref. Chapman S. and Nakilny R. 2003, Aids to Radiological Differential Diagnosis. 4th edition. London, Saunders Limited p. 404. 25 of these are all features of tuberous sclerosis. Ref. Chapman S. and Nakilny R. 2003, Aids to Radiological Differential Diagnosis. 4th edition. London, Saunders Limited p. 450 to 451. Answers. Question bank. 26. A 20-year-old woman has a right-sided proptosis, chemosis and bruit over the orbit. On MRI she is found to have dense enhancement of the right-sided extraocular muscles with dilatation of the right cavernous sinus and periorbital soft tissues. Angiography reveals abnormal earlier pacification of a dilated left cavernous sinus and superior ophthalmic vein. Which is the most likely diagnosis? A carotid cavernous fistula, B. Thyroid eye disease, C. Orbital pseudotumor, D. Retroorbital metastases, E. Optic nerve plexiform neurofibroma. 26. A Mr. Angiography shows reversal of flow through the superior ophthalmic vein, SOV, rapid progress of proptosis, visual loss or raised intracranial pressure requiring emergency treatment. (27) A 60-year-old woman with mild proptosis undergoes a CT which shows enlargement of the bellies of the medial, and to a lesser extent, lateral rectus muscle. Tendons appear normal. What is the likely diagnosis? A. Idiopathic orbital myositis, B. Carotid cavernous fistulae, C. Retroorbital metastases, D. Graves' ophthalmopathy, E. Plexiform neurofibroma of optic nerve. Treatment. 27. Sparing of muscle tendons is typical. Most cases are bilateral. 28. E-drop metastases are usually dorsal in location in the spinal canal. 28. A follow-up of a young man under the care of the neuro-oncologists reveals a drop in metastases. Which statement is most true? A. Drop metastases tend to be in the upper spine. B. Metastases within the spinal canal are usually ventral. C. Glioblastoma is the commonest cause of drop metastases. D. Are associated with positive CSF cytology in approximately 10% of cases. E usually demonstrates homogeneous enhancement with contrast. 180. Canal. Medulloblastoma are the most common cause of drop metastases. A higher percentage of CSF cytology is positive. Module 6, Central Nervous System and Head and Neck. 29. Which is the most common imaging finding in neurosarcoidosis? A leptomeningeal contrast enhancement, B hyperintense white matter, T2 lesion, C gray matter lesions enhancing on Mr. D involvement of the hypothalamus, E focal epidural masses. 30. In her positive. 29. A basilar meninges often involved. B are recognized imaging findings. Spinal disease is less common than brain disease and findings include intramedullary lesions and intrathecal nodular masses. Ref. Herpes simplex virus, HSV, type 1 encephalitis. Early CT findings include hyperdensity in one or both temporal lobes. B. Avid contrast enhancement in the temporal lobes is often present on C7. C. Mr. shows avid contrast enhancement in the temporal lobes. D. The basal ganglia are typically spare. D. Signal abnormalities are usually persistent even after drug treatment. Module 6, Central Nervous System and Head and Neck. 30D early CT findings may show medial temporal hypodensity. Areas poorly enhance on CT and Mr. signal abnormalities often decrease in response to treatment. Treatment. 31. A patient with a genetic condition and known bilateral renal cysts undergoes MRI brain showing a cystic lesion with mural nodule. This finding is associated with a VHLB tuberous sclerosis, C. Sturge-Weber, D. hereditary hemorrhagic telangiectasia, HHT, E. neurofibromatosis. Treatment. 31. A 1-3 hemangioblastoma are purely solid, 1-3 are cystic with mural nodes and 1-3 are cystic with a more complex solid component. Ref. Provenzale, J.M. and Nelson, R.C., 1998, Duke Radiology Case Review, Imaging, Differential Diagnosis, and Discussion. Philadelphia, Lippincott Williams and Wilkins. p. 327. Neurofibromatosis. 32. Tram-tracture-reform calcification is most likely to be seen in a NFIB tuberous sclerosis, C. von Hippel-Lindau, DHHTE Sturge-Weber. 327. 32. Other features include cerebral atrophy with thickening of skull vault and surface enhancement, enlarged choroid plexus and enlarged medullary forward/subendymal veins. Choroid angioma may be present. Ref. Chapman S. and Nakilny R. 2003, Aids to Radiological Differential Diagnosis. 4th edition. London, Saunders Limited, p. 451. Question bank. 33. A 2 cm mass is seen on Mr. at the left CPA with uniform enhancement and high psi on T2 and dural tail. What is the diagnosis? A meningioma, B. vestibular schwannoma, C. epidermoid, D. metastatic deposit, E. glomus tumor. 451. 33. A broad-based attachment to petrous bone. More homogeneous psi and less bright T2. Uniform enhancement distinguishes from vestibular schwannoma.